As a parent, one of the most confusing aspects of our child's special education journey is the very beginning. Why? Because we don't know what we don't know. Okay, so right now, you're most likely thinking, what is that supposed to mean, Luke? It's simple, actually. As parents, we are not trained to properly identify different characteristics that could show early signs of a potential challenge. We don't recognize them. However, at some point, we begin to question whether or not there could be a challenge. Whether by comparing our child's progress to a friend's child of similar age or to an older sibling, something seems different. That's when we tend to begin our consultation with Google. Today, I want to shed some light on early characteristics and signs of autism. Please note, and this is very important, many children who do not have autism tend to show a few of these signs we'll cover today. It's for this reason that it's imperative to seek a professional evaluation if you feel like your child may indeed have autism. Welcome to this episode of Special Education Decoded. First, for folks who aren't quite sure exactly what autism is, let's start with a definition according to IDEA. Autism means a developmental disability significantly affecting both verbal and nonverbal communication, along with social interaction. Generally evident before age 3 and adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. The severity of these symptoms and others range greatly from one person to another. For some children, signs of autism are obvious. For others, that is not the case, especially when they're young. Let's unpack some of the most common signs of autism based on age, starting with a child around 6 months old. At this age, children with autism exhibit signs such as big smiles are hard to come by or non-existent. There's a lack of warm, joyful, and engaging expressions. Eye contact is either limited or non-existent. When a child gets to the 9-month-old range, you may notice limited back and forth sharing of sounds and facial expressions such as smiles. At the 1-year mark, many children with autism show signs such as the typical babbling of a child that age either doesn't exist or is very limited. Back and forth gestures are infrequent or non-existent. Things such as pointing or showing, reaching, and waving. There's very little or complete absence in their responding to their name. Around 16 months, a child will speak very few or no meaningful two-phrase words. At any age, there are a handful of signs that are prevalent in many folks with autism. Many children begin to lose previously acquired speech. This includes babbling. Social skills often diminish. People often avoid eye contact. People with autism strongly prefer solitude. People with autism often have difficulty understanding other people's feelings. And as we discussed prior, language development is often delayed. There's a persistent repetition of words or phrases. There's resistance to minor changes in routine or surroundings. This is very difficult for so many over the past few months. Restricted interests, very focused on a handful of things, sometimes only one. Repetitive behaviors, things such as flapping, rocking, spinning, etc. Unusual and intense reactions to sound, smells, tastes, textures, lights, or colors. Next, if you think your child may have autism, there are a few different quick questionnaires you can fill out before taking the next step toward a professional evaluation. One of those tests is called the Modified Checklist for Autism in Toddlers, Revised. And as you may have imagined, just like everything else in special education, this test does go by an acronym, MCATR. This test is a series of 20 questions about your child's behavior and intended for toddlers between the ages of 16 and 30 months. The results of the MCATR test will let you know if a further evaluation may be needed. The nice part about this test is that you can use the results to discuss any concerns that you may have with your child's healthcare provider. A direct link to the MCATR test can be found in the description of this video. The last thing I want to cover in this video is potentially the most important topic covered today. That is the actual label of autism and any other special need or learning disability for that matter. From personal experience, I know many parents have a preconceived notion that labels are bad and that a negative stigma exists around special education. But here's the truth. Labels are designed specifically to ensure children receive the help they need in order to reach their excellence. Period. A label of autism will trigger the appropriate services for your child specifically as they approach school age, and in many cases, even before that point. Special education teaching is less about different curriculum or working with children who struggle, and more about working with children in the way they understand best. In our organization, we have the opportunity to work with many children who have never actually been diagnosed with anything. Why? Because we are able to connect with them in the way they learn best and effectively identify their missing foundational piece. This personalized learning experience leads to a massive boost in self-confidence, and the mental hurdle of, I can't do this, quickly morphs into the belief of, maybe I can do this. Success begins from this point. If you have any questions whatsoever about whether or not your child could benefit from a more personalized one-on-one approach, please check the description of this video. I would love to chat with you regarding areas of challenge your child is currently experiencing and work to build back their confidence and help forge a path of success. From all of us at specialedresource.com, thank you for watching this episode of Special Education Decoded. We'll catch you in the next video. Thank you for watching this video until the end. Please take a moment, give us a thumbs up. Your support means the world to us. If there's a specific topic you're interested in, please leave a comment. Until then, enjoy these other videos designed to help parents navigate the crazy world of special education. Thank you.